get started with just over 200 people.
Yeah,
right,
we should
go
do
ahead and get started then. So yeah, good afternoon. Welcome everyone to the DAP CYE 2025 webinar. Today we will be presenting on the requirements, milestones, deadlines, and everything new to the upcoming contract year in the world of DAP. For those who don't know me, my name is Tyler Winkus. I am a quality advisor here at Contexture. Today you'll also hear from my colleagues Cassie Dercho, who is a quality improvement advisor, as I'm sure many of you work with, along with our manager of quality and payment programs, Israel Ortiz. Before we get started today, I'd like to ask everyone if I could to drop your name and organization that you represent in the chat. I just want to make sure everybody has access and can utilize the chat feature during today's webinar, because our team will be monitoring the chat throughout the presentation to collect questions from you all, and then they'll be answered at the end of the webinar during our Q&A period. So if you want to just make sure everybody has access, we'll keep track of that, and then we'll go through everything at the end. So make your questions will get answered. And then next slide, please. All right, so here, in addition to Israel, the other member of our quality leadership team here at Contexture is our Director of Quality and Payment Programs, Megan Riley. Please. As mentioned earlier, you'll hear from Cassie, again, who's one of our quality improvement advisors. And then my colleague, Colin McDonald, will also be assisting me in the chat, collecting questions from you all throughout. The team you see listed here is a dedicated team for the DAP program, as I'm sure many of you have seen how the program has evolved over the years. It can be very complex at times. So we want to make sure we're committed to you all. Each organization will have a dedicated quality improvement advisor in the DAP program to assist them with all their DAP needs throughout the contract year. For those of you who we're already working with, we obviously look forward to continuing that relationship. And for those who may be new to DAP and learning new things, we look forward to working with you in the future. So now I'd like to hand things off to Israel, who's going to go over the full agenda for today's webinar and kick things off for us. Israel?
Thank you, Tyler. Good afternoon, everybody. Happy Valentine's Day. This is our agenda for today. We'll talk about Contexture. We'll do a quick review of the DAP provider eligibility, a quick overview of the AZHDR and SDOH programs. We'll cover provider type requirements, statement of work process, roles and responsibilities, and lastly, we will have a section for the questions like Tyler was mentioning. Right, so let's talk about Contexture, who we are, what we do, and what is our mission. Who we are. Contexture is the leading health information exchange, the AHCCCS, for Arizona and Colorado. We are the largest health information organization in the Western region. What we do. Contexture is a nonprofit organization that provides strategic, technical, and administrative support to communities committed to the advancing health through the information sharing. Our mission is advancing individual and communities' health and wellness through the delivery of actionable information and analysis. Now, let me cover a little bit of history of Contexture in the state of Arizona. As you know, formerly known as Health Current, was founded in 2007. Our services allow providers to securely share clinical information among different information systems. We partner with about 1,100 participants, and we continue to grow. There are 300 data sources sharing medical records. We securely store and share 12+ million individuals' data. As we know, we are the home of the Arizona Healthcare Directive Registry and the SDOH Referral System Communicators. And we joined Coreo, the Colorado-based HIE in 2021, to form Contexture. I'll pass it to Cassie. She'll start our review of the DAP CYE 2025 and provider type eligibility. Cassie?
Thank you, Israel. So the purpose of this webinar is to clarify and review DAP eligibility and requirements for Contexture programs within the DAP. Access does offer other programs that are not ran by Contexture, and you can find that full list on the Access preliminary notice. On this slide here, you'll see all of the eligible provider types for the Contexture ran DAP programs. Every provider type listed here is eligible for at least one DAP program. Crisis providers are only eligible for the crisis bed registry. We will be going over eligibility and requirements for all provider types listed in more detail. Next slide, please. So what is DAP? DAP aims to distinguish providers who support actions that improve patients' care experiences, patient health outcomes, and help reduce costs of care. DAP is a value-based payment strategy where Access offers payment increases to eligible providers for completing program milestones and requirements. HIE data access is a crucial component of DAP and has been a key component of DAP since 2017. In addition to HIE DAP, there are other programs, as mentioned before, like SDOH and AZHDR, which we'll review today. And DAP is scheduled based on a contract year end, or CYE. The program starts October 1st and ends September 30th of the following year. Next slide, please. The preliminary public notice was posted to the Access website on January 31st, 2024, and is open for public comments through March 1st, 2024. The final public notice is set to be released around March 16th. And Kyle, I think, is going to chat in the links for the preliminary public notice, and he'll put our Contexture website in the chat as well. Next slide.
All right, so let me take a moment here to review a little bit of the Arizona Healthcare Directives Registry Program. This is a statewide registry for advanced directives available to all Arizonans. It is designed to help honor patients' end-of-life healthcare preferences, and it's a secure online platform that is available at no cost and offers easy access to healthcare providers and facilities at the time of a medical need. It is important to mention that providers need to sign up to participate. This registry allows for both submitting and viewing advanced directives. Hospitals and providers can get a DAP increase upon the AZHDR milestone completion.
We will now review the SDOH referral system, which is Community Cares. Community Cares is a single and statewide referral system for social determinants of health. Contexture has teamed up with Access and is collaborating with Solari, Crisis and Human Services, and 211 Arizona to implement Community Cares to address SDOH needs in Arizona. This is a new technology platform powered by Unite Us. The system is designed to connect healthcare providers and community-based organizations to streamline the referral process. Eligible hospitals and providers can get a DAP increase upon SDOH milestone completion.
All right, so here you can see a table that displays the eligible provider types. And also shows the respective percentage increase for CYE 2025. Again, like Cassie mentioned, this is only talking about the programs that Contexture manage through the DAP. There's additional programs and additional provider types that are not listed here, so you will have to find those in the public notice. First, you can see here hospitals and other hospitals are eligible, and let me use my pointer just to make it easier to follow. So hospitals and other hospitals, they are eligible for HIE. This is a new program, the HIE Data Quality Indicators, and they're eligible for SDOH. Critical access hospitals and IHS are eligible for HIE, SDOH, and AZHDR. Nursing facilities are eligible for HIE and HDR. Behavioral health outpatient clinics and integrated clinics are eligible for HIE and SDOH. Primary care providers, in this case, physicians, MDs, DOs, physician assistants, registered nurse practitioners are eligible for SDOH. Now, when these primary care providers have any of these specialties, like OBGYN, pediatrics, cardiology, and nephrology, they are also eligible for HIE. If they don't have any of these specialties, they are not eligible for HIE. Behavioral health providers are eligible for SDOH. Home community-based service providers, divided by like provider type 23, they are eligible for HIE and SDOH. Provider type 49 are only eligible for HIE. Provider types 39, 40, 46, 95, and F1 are eligible for SDOH. Like Cassie mentioned, crisis providers are eligible for crisis bed registry, but they had to have a SAO signed by December 31st, 2022. Now, Cassie will cover the requirements specifically for hospitals and other hospitals.
All right. For CYE 2025, we have split participants into cohorts. Throughout the webinar, we will talk about cohort 1, which refers to established providers who have participated in CYE 2023 and or CYE 2024. Cohort 2 will refer to net new participants. So for cohort 1 for hospitals and other hospitals, milestone 1, which is the same milestone throughout or for every provider type, is to sign a participation agreement and a statement of work, which is due April 1st, 2024. Milestones 2, 3, and 4 are related to Contexture's existing HIE platform, and milestones 5 through 11 are related to Contexture's new HIE platform, which is called One Platform. So just a breakdown of these milestones. Milestones 2, 5, and 6 are all due on the same day. They're due by May 1st and refer to actively accessing at least one HIE service, such as the portal, notifications, or admit, transfer, and discharge alerts, or ADT alerts. Also completion of the HIE workbook for the integration to One Platform. For those established hospitals that are on the call, we have been sending reminders to established providers to get those workbooks in if you have not already. So keep a lookout for those emails. And then also to submit a PACS SAO, which is something that's new this year, which will allow hospitals to view imaging instead of just reading the radiology report. Those actual images will populate into the HIE. Milestones 3 and 4 are due by May 31st and refer to utilizing an external reference lab, and hospitals should be submitting data to the HIE. For milestone 7, due by September 1st, 2024, hospitals must launch the integration implementation project and have a VPN connection with One Platform and should be sending us test data. Milestone 8 is due by December 30th, 2024. Hospitals must electronically submit data to the production environment in One Platform. For milestone 9, due February 28th, 2025, this one refers to multiple new agreements for One Platform, including an HIE participation agreement, an SOW for portal access, and an SOW to send data. Milestone 10 is due May 1st of 2025 and requires hospitals to launch a One Platform portal project to access patient health information via the HIE, and One Platform portal training must be completed before that access is granted. Finally, milestone 11 is due July 30th, 2025, and requires hospitals to actively access and continuously access patient health information via the HIE One Platform portal. Next slide. Now for cohort 2 or net new participants who did not participate in DAP CYE 2023 or 2024, Milestone 1 is again that HIE participation agreement and SOW that needs to be submitted by April 1st, 2024. Milestone 2 is due October 1st, 2024, and requires hospitals to launch the implementation project to access the current HIE portal and complete portal training. Milestone 3 is to actively access and continue to access the patient health information via the current HIE portal, and that is due by December 30th, 2024. Milestone 4, due February 28th, 2025, refers to those new agreements again for one platform, including the participation agreement for HIE, an SOW for portal access, and an SOW to send data to the HIE. Milestone 5 is due by May 1st, 2025, and requires hospitals to launch a portal project for one platform and complete portal training before gaining access to the HIE. Milestone 6 is due July 30th, 2025, and requires hospitals to actively access and continually access patient health information via the HIE One platform portal. Milestone 7 is due August 1st, 2025, and refers to any hospital that utilizes an external reference lab, such as LabCorp. They would have to submit any necessary prior authorization forms to allow lab results to flow into the HIE. Milestone 8, also due by August 1st, 2025, states that hospitals must launch the hospital integration implementation project and have a VPN connection with one platform and should be sending data to our test environment. And finally, milestone 9, due by September 30th, 2025, hospitals must electronically submit data to the production environment in one platform. Next slide. This is the new program for CYE 2025, and it's for data quality indicators or DQI requirements. These milestones are only required for cohort 1 hospitals and other hospitals. Milestone 1 is again that HIE participation agreement and statement of work due April 1st. Milestones 2 through 4, within 30 days of sending test data, Contexture will send an HIE data quality report to these participants. This report will identify risk parameters, high and moderate. Participants need to review these risk parameters so that within 60 days of sending test data, the participants must reduce the high risk parameters to 0. This is needed in order to send data to the production environment. Lastly, no later than December 1st, the participant is required to submit a written resolution plan to correct the moderate risk parameters identified in the HIE data quality report. Next slide. SDOH requirements for hospitals and other hospitals. Again, there are 2 cohorts. For cohort 1, milestone 1 is by April 1st, 2024. Hospitals must have an active community cares agreement and sign a DAP SOW. Milestone 2, by September 30th, 2024, the hospital must participate in a post-live meeting with their SDOH advisor to define in-network screening and referral monthly goals. This time can also be used to brainstorm workflows or discuss any training needs if necessary. Milestone 3, from October 1st, 2024 to September 30th, 2025, hospitals must utilize the Community Cares platform for screenings and referrals. Based on the screening and referral average from CYE 2024, we are expecting to see a 5% improvement in those screenings and referrals, but no less than 10 referrals per month. For milestone 4, hospitals must meet with their SDOH advisor quarterly to review goal progress and come up with an improvement plan if their goals are not being met. For cohort 2, the net new providers for SDOH, Milestone 1 is again that DAP SOW and a community cares agreement submitted by April 1st. Milestone 2 is by January 1st, 2025. Hospitals should complete their community cares onboarding and start utilizing the platform for screenings and referrals. By Milestone 3 requires that hospitals have quarterly meetings with their SDOH advisor to define goals and review progress, and again, come up with that improvement plan if goals are not being met. Next slide.
All right. So now I'll talk about critical access hospitals. And I want to mention here, so there's going to be a lot of repetitiveness as far as milestones and dates. So from now on, we have to go through many more provider types. So we're going to go a little bit faster and less detailed now, but it's very important for you all to look at the preliminary public notice and look very careful with the milestones and reach out to your quality improvement advisor for any questions, or if it's questions related to the HDR or SDOH, please reach out to your advisor respectively. All right, so moving on to critical access, very similar. I should say pretty much the same as Cassie just explained. So we have two cohorts, as Cassie was mentioning. So cohort 1 is always going to talk about participants that were established in 2023 and CYE 2023 or CYE 2024. And cohort 2, it will be net new participants or new to CYE 2025. So the milestones for critical access hospitals and as far as HIA requirements, same thing. Milestone 1 is going to be either the PA or CCA, the community cares agreement, if it's related to SDOH, and the DAP South. Always going to be the same milestone, and it's going to be due April 1st. Milestone 2, like Cassie was mentioning, actively accessing at least one current HIE service, like portal, notifications, things like that. Milestone 3 is to have established that external reference lab by May 31st of 2024. Same date that continues sending electronic data to the HIE via ADT. Milestone 5 by May 1st to complete that HIE workbook that also Cassie mentioned that we've been emailing and sending that communication to participants to complete that workbook by May 1st. The new milestone as submitting the picture achieving and communication system, the PAC South, is also due May 1st. This one is like Cassie was mentioning, will allow hospitals to view imaging instead of just reading the radiology report. Milestone 7 by September 1st, 2024. Hospitals must launch the hospital integration implementation project and have a VPN connection with one platform and should be sending that test data by September 1st. December 30th for milestone 8 will be electronically submitting that data to the one platform, but now into the production environment. Milestone 9 due in February 28th, the different forms like the participation agreement to the HIE, statement of work for the one platform portal and the data centers, and statement of work as well. Milestone 10 is to launch the one platform portal project and get trained on that by May 1st. And lastly, milestone 11 due July 30th, 2025, that requires hospitals to actively access and continually access patient health information using that HIE platform. Cohort 2 for HIE requirements, same thing, PA statement of work by April 1st. Due October 1st, hospitals must launch the implementation project to access to the current HIE portal and complete that training. Milestone 3, actively accessing that HIE portal by December 30th this year. Milestone 4, completing all those forms by February 28th, 2025, which is the PA and the statement of work for the One Platform portal and the data centers. Milestone 5, which is due May 1st, 2025, is to launch the portal project, but now to the One Platform. And the training needs to be completed by May 1st. By July 30th, actively continuing accessing to that HIE portal. Milestone 7, due August 1st, refers to any hospital that utilizes the external lab reference, such a LabCorp, like Cassie mentioned. They will have to submit a necessary prior authorization forms to allow lab results to flow into the HIE. Milestone 8, August 1, 2025, states that hospitals must launch that project and VPN connection to One Platform and should be sending test data. By September 30th, 2025, that needs to be sending electronic data to One Platform in the production environment. SDH requirements for critical access are exactly the same as Cassie talked previously. So milestone 1 is the DAP, and in this case, you can see instead of the PA is the communicator agreement submitted by April 1st. Milestone 2 is to have, sorry, I'm hearing some background noise. We all can mute ourselves, that'd be great. Post-live meeting with the SDH advisor to define goals. So like Cassie mentioned, this time also can be used to brainstorm workflows and discuss training needs. From October 1st, 2024 and September 30th, 2025, which is the contract year period, hospitals must utilize the communicators platform for screenings and referrals. So when you're meeting with your SDH advisor, you're going to look at the screening and referral average of the CYE 2024. So just to set your goals. So again, the expectation is to see a 5% improvement, but not less than 10 referrals per month. And lastly, milestone 4, the hospitals must meet with the SDH advisor in a quarterly basis to review the goal progress. And if it's needed, an improvement plan needs to be completed. So for cohort 2, same thing, DAP, SAO, and the communicators agreement submitted by April 1st. The milestone 2 is to complete the community cares onboarding and start using the platform by facilitating screenings and referrals. And that needs to happen by January 1st. Milestone 3, same thing, requires to meet with the SDH advisor on a quarterly basis. Here, once you start utilizing the platform, that's when you're going to define the goals based on that usage. Quarterly meetings also are going to be used to review that progress and to complete an improvement plan if needed. The Arizona Healthcare Directive Registry requirements for critical access are the same, similar, I should say. So the participation agreement and the DAP statement of work needs to be submitted by April 1st. Here for cohort 1, again, cohort 1 established participants, cohort 2 new in CYE 2025, basically. So for cohort 1, the milestone 2, the expectation is that they continue to utilize the AZHDR platform, and we want to see at least 5 advanced directives uploads per month and 15 advanced directive searches per month. And this will be measured during the contract year, October 1st, 2024 through September 30th, 2025. Cohort 2, again, the participation agreement and the SAO submitted by April 1st. Cohort 2 is to complete the AZHDR subscription agreement by November 1st, 2024. Milestone 3 is to get onboarded and trained on the platform by April 1st, 2025. And also, we would like to start seeing the utilization of that AZHDR platform, but at least getting 5 uploads or searches of advanced directives into the platform. And this needs to be completed by May 1st, 2025. Right, so I'll pass it to you, Cassie.
Thank you. We will now go over program requirements for Indian Health Services facilities. Next slide, please. This one again has 2 cohorts for HIE, or 2 cohorts altogether, I suppose. For cohort 1, again, we have that milestone 1 with the participation agreement and that DAP SAO that we need submitted by April 1st. This is very similar to the other HIE for the hospitals. Milestones 2 through 4 are again related to the existing platform, and milestones 5 and below are related to one platform requirements. So milestone 2, we want to make sure that you're accessing those the current HIE services. Milestone 3, if you utilize an external reference lab, we need to be seeing that data. And you need to electronically submit data to the HIE. Those are due May 31st, and the milestone 2 is due May 1st. Milestone 5, we need that workbook completed and submitted by May 1st. We do need that workbook completed to like full completion, as the emails state that we've sent out. Milestone 6, we want you to launch a project to one platform and send test data. Milestone 7, by December 30th, 2024, we need you to electronically submit data to one platform in the production environment. Milestone 8, we need those agreements again, that HIE prior authorization or participation agreement, a statement of work for the one platform portal, and a data sender statement of work. That's all 3 of those are due February 28th, 2025. Milestone 9, we need that one platform HIE portal project launched, and training has to be completed by May 1st, 2025. And milestone 10, you have to actively access and continue to access the one platform HIE portal. These milestones are all pretty similar to the hospitals. We just minus the requirement of that PAC SAO to view the actual images. Cohort 2 for net new providers. Again, milestone 1 is that participation agreement and statement of work. Milestone 2, due by October 1st, 2024, is to launch a project to the current HIE portal and complete your training. Milestone 3, due December 30th, 2024, you have to be actively accessing the current HIE portal. Milestone 4, due February 28th, 2025, is those agreements again, the HIE participation agreement, SAOs for the portal, and a data sender SAO. Milestone 5, we need that portal project launched for one platform, and training has to be completed by May 1st of 2025. And milestone 6, you need to actively access and continue to access the one platform HIE portal by July 30th of 2025. Next slide. The SDOH requirements for IHS facilities is exactly the same as it is for that Israel already covered. So I apologize the repetitiveness. The milestone 1 is the DAP SAO and a community cares agreement by April 1st. Milestone 2 is to have that post-live meeting with your SDOH advisor to define your monthly goals. That is due by September 30th, 2024. Milestone 3, this is for cohort 1, by the way. Milestone 3 is to utilize the community cares platform for screenings and referrals. Again, based on the referral and screening average in CYE 2024, we expect to see a 5% improvement, but no less than 10 referrals per month. Milestone 4 is that you must meet with your SDOH advisor quarterly to review the goal progress and come up with that improvement plan if needed. For cohort 2, milestone 1 remains the same. Milestone 2 is by January 1st, 2025, hospitals should complete a community cares agreement and start utilizing the platform for screenings and referrals. And milestone 3, again, you have to have those quarterly meetings with your SDOH advisor to review goals, review progress and define goals, I apologize, and come up with that improvement plan if needed. Next slide. There are also 2 cohorts for AZHDR for IHS facilities. The difference for IHS facilities is that cohort 1 is only if you participated in CYE 2024, whereas previously it was CYE 2023 and or 2024. So that is a little different here. Milestone 1 for cohort 1 is the same, the HIE participation agreement and that DAP SAL by April 1st. Milestone 2, we want you to be utilizing the AZHDR platform by uploading at least 5 advanced directives per month and having at least 15 advanced directive searches per month. Cohort 2, milestone 1 is still that HIE and DAP, or that HIE PA and DAP SAL by April 1st. Milestone 2 is to have this AZHDR subscription agreement submitted by November 1st, 2024. Milestone 3 requires onboarding and training to be completed by April 1st, 2025. And milestone 4 requires that you utilize the platform by uploading or searching at least 5 advanced directives per month. Israel, we'll go back to you.
Thanks, Cassie. So
You're
now
welcome.
let's review the nursing facilities provided type 22. Same thing here. Again, apologize for repeating the same thing over and over. We just want to make sure that provided types understand their milestones. Same thing here. The only difference is the PACS statement of work is removed for the cohort 1 nursing facilities. Same dates. I'm just gonna list it really quick so we can move on. So the HIE and the SAL needs to be submitted April 1st. Actively accessing at least one service from the current HIE services, May 1st, having the external reference lab. May 31st, the same thing, having submitting the electronic data to the HIE via ADT, the same date, May 31st. Complete the HIE workbook, May 1st. Launch the project and VPN connection to the one platform in a test environment September 1st, and then submitting electronic data to the one platform in the production environment by December 30th, 2024. Completing the forms PA statement of work for the portal and the data centers by February 28, 2025. Launching now the portal project and completed training for the one platform, the new platform, by May 1st, 2025, and actively accessing and continue accessing that HIE portal by July 30th, 2025. Cohort 2, again, new participants in CYE 2025, getting that HIE and SAL submitted by April 1st, launching the project for the current HIE portal and completing training by October 1st, 2024, actively accessing that portal by December 30th, 2024, and completing the PA statement of work for the one platform portal and data centers for by February 28, 2025, launching the project for the new one platform HIE portal and complete training by May 1st, 2025, actively accessing that HIE portal from the one platform by July 30th, 2025, establishing the external reference lab by August 1st, 2025, launching that VPN connection to the test environment to the one platform by August 1st, 2025, and finally submitting electronically that data put into production environment by September 30th, 2025. So nursing facilities are eligible for HDR requirements as well. So like Cassie mentioned, the only difference to critical access is that cohort 1 participating in 2024 instead of like 2023 or 2024. So the cohort 1 milestone is to submit that PA and SAL by April 1st, 2024. We want to see that utilization increasing, so we expect to see at least 5 advanced directives uploads per month and at least 15 advanced directive searches per month during the contract year. For cohort 2, new to CYE 2025, the milestone 1 is the same, obtaining that participation agreement and that SAL by April 1st, completing the ACHDR subscription agreement by November 1st, 2024, getting trained and onboarded to the platform by April 1st, 2025, and start using that platform by uploading or searching at least 5 advanced directives per month by May 1st, 2025. Right, let's talk about behavioral health, outpatient, and integrated clinics, Cassie.
So again, HIE requirements for cohort 1 remain the same. That HIE, PA, and SAL by April 1st. We want you to actively access the current HIE by May 1st. External reference labs and submitting data to the HIE are due by May 31st of this year. And then for the new platform, the one platform requirements, milestone 5 is to complete the workbook by May 1st and get that sent over to us. Milestone 6 is to launch a project and VPN connection to the one platform in the test environment by September 1st of this year. Milestone 7 is to electronically submit data to one platform in the production environment by December 30th of this year. By February 28th of 2025, we need that HIE PA, the SAL for the portal, and the SAL for the data center. Milestone 9 is to launch a one platform portal project and complete that training by May 1st, 2025. And milestone 10 is to actively and continually access the one platform HIE portal due by July 30th, 2025. Next slide. Cohort 2 for BHOCs and ICs is, again, the HIE-PA and SOW submitted April 1st. We want you to launch a project for the current HIE portal and complete training by October 1st of this year. And by December 30th of this year, we want you to actively access our current HIE portal. Milestone 4, due February 28th of 2025, is that HIE-PA and the SALs for both data center and the portal. For one platform. Milestone 5, again, is to launch that one platform HIE portal project and complete training by May 1st, 2025. Milestone 6 is to actively and continually access the HIE platform, one platform portal by July 30th. Milestone 7 refers to those external reference labs. We need the agreement signed so that we can have those labs flow into the HIE by August 1st. And also due August 1st is to launch the project and VPN connection to the test environment of the one platform HIE. Finally, milestone 9 is to electronically submit data to one platform in the production environment by September 30th of 2025. Next slide, please. SDOH requirements remain the same for cohort 1 and cohort 2. Milestone 1 is the DAP SAL and the Community Cares Agreement by April 1st. Milestone 2 is a post-live meeting with your SDOH advisor to define those monthly goals. That needs to be done by September 30th, 2024. Milestone 3 is to utilize the Community Cares platform for screenings and referrals. Again, we want to show a 5% improvement from CYE 2024, but no less than 10 referrals per month. Milestone 4 is to meet with your SDOH advisor to review those goals and complete an improvement plan if needed. Cohort 2, same thing, DAP, SOW, and a Community Cares Agreement submitted by April 1st. And then we want you to complete Community Cares onboarding and you start utilizing the platform. And milestone 3 is again to meet with your SDOH advisor to go over progress. Next slide. Israel.
All right, thank you. So we're gonna go faster and faster now, I promise. So for specialty providers, again, like I mentioned, only having those 4 specialty OBGYN, pediatrics, cardiology, nephrology are eligible for HIE. If you don't have those specialties, you are not eligible for HIE, just SDOH. Same thing, having that participation agreement and SAP submitted by April 1st, actively accessing the current HIE services by May 1st, having completed those PAs and similar work for the One Platform portal by February 28th, 2025, launching the HIE portal project and completing the training by May 1st, 2025, and actively accessing that portal by July 30th, 2025. All right, so for cohort 2, we have the same thing as far as milestone 1. We need to create that project for the current HIE portal, and training needs to be completed by October 1st, 2024. Actively accessing the current HIE portal by December 30th this year, completing the PA statement of work for the One Platform portal by February 28, 2025. Then launch the HIE portal to the One Platform project, and training needs to be completed by May 1st, 2025, and actively accessing that HIE One Platform portal by July 30th, 2025. SDH requirements are exactly the same for primary care providers and specialty providers. So I won't read this anymore since they're exactly the same. Please refer to the preliminary public notice for more details, or reach out to us for any questions. All right, Cassie, I'll pass it to you for behavioral health providers.
Thank you. Behavioral health providers are only eligible for SDOH. So again, I will not read this again. I won't bore you with that, but please refer to the Access Preliminary Public Notice if you have additional questions or need additional information on behavioral health providers participating in the SDOH program. Israel, if you want to do HCBSs.
Yeah, I'll take HCBSs. Same thing for, sorry, I think I went back. Hold on, HCBSs. So for provided types 23 and 49 are eligible for HIE, and these are very similar requirements. So having that PA and similar work submitted by April 1st, actively accessing current HIE services by May 1st, completing the PA similar work for One Platform portal February 28, 2025, and then launching the HIE portal project to the One Platform and completing the training by May 1st, 2025, and actively accessing that One Platform HIE portal by July 30th, 2025. Cohort 2, for those same provider types, 23 and 49 only, again, is getting that PA and SAL agreement submitted by April 1st, launching the project for the HIE portal and training completed to the current portal by October 1st, 2024, and actively using that HIE portal by December 30th, completing the PA and similar work for the One Platform portal by February 28, 2025, and then subsequently launching the project for the One Platform HIE portal and completing training by May 1st, 2025, and we continue accessing that HIE One Platform portal by July 30th, 2025. The SDOH requirements are exactly the same, but I just want to mention that, again, that only the HCBS providers that are eligible for SDOH is provider F1, 23, 39, 40, 46, and 95. All right, so moving on to the crisis bed registry providers, Cassie.
All right, so as we mentioned at the beginning of the webinar, only existing participants with a crisis bed registry statement of work that was signed by December 31st of 2022 are allowed to participate in the crisis bed registry program. We do not have any net new crisis bed registry participants. So for milestone 1, again, it's that participation agreement in DAP SAL due April 1st. For milestone 2, from April 1st, 2024 to September 30th, 2024, crisis providers must continue to send HL7 data via HL7 interface or batch files if the interface is not yet implemented. All downtime must be resolved in a timely manner. And the goal is to transition from batch files to an HL7 interface. For participants currently sending batch files, milestone 3 is due by October 1st, 2024. Providers must attend a vendor discovery call and complete a crisis bed registry attestation, which agrees to send HL7 data to the HIE, and the provider agrees to any EHR vendor fees for vendor customization. Milestone 4 is due March 1st, 2025. Providers will send test messages to the HIE that meet the required crisis bed registry specifications. And finally, milestone 5 is due September 1st, 2025, and providers must electronically submit crisis bed registry HL7 messages to the production environment. Next slide.
All right, so now let's take a quick look at the statement of work submission process. So the QA advisors preloaded a form, the participant list form, and send that out to all the organizations based on the active participation in CYE 2024. Please send that back by by February 16, which is this Friday. You're a net new participant, you have not received that, please reach out to us to dap@contexture.org so we can send you a blank copy of the participant list form. Once we have that form, we'll put that back into the statement of work as an Exhibit B. Our engagement team will send that statement of work to your organization, to the authorized signer via DocuSign. So please review, complete, and sign that DocuSign and send it back to us no later than April 1st, 2024, which is, again, the first milestone of all these programs. Let's talk about the roles and responsibility really quick. Cassie, if you don't mind.
Yeah, so milestones vary based on your provider type and are progressive over time. For each HIE milestone referenced in the DAP CYE 2025 preliminary notice, these slides provide a description of the respective roles and responsibilities for both Contexture and the Access participating provider. It's important to review the milestones that apply to your organization and the respective roles and responsibilities to determine what steps and activities must be completed in order to achieve the milestone. Next slide.
All right, so as far as the scope of work, so the participant needs to contact Contexture as soon as possible, complete and return that participant list by February 16, 2024. The authorized representative to execute that SAL via the DocuSign no later than April 1st. Contextual responsibility is to provide that participant list form to participants, review and attach the participant list form as an exhibit to the statement of work, send the statement of work to the authorized representative.
As far as ADT submissions, the participant, along with any vendor partners, should complete activities related to interface development and ADT data submission. It's important for the participant to stay engaged and meet all mutually agreed upon deadlines and requirements in order to meet all DAP deadlines. Contexture will provide the participant with detailed technical specifications listing the types of data required for submission within each category noted, and will assign resources and complete all agreed upon timelines and activities to ensure that the participant meets their DAP deadlines.
Right, so as far as the data quality indicators, again, this is just for hospitals and other hospitals. So we ask that participants stay engaged with Contexture integration team, complete activities related to the completion of the data quality analysis tool, meet all mutual agreed upon deadlines and requirements in order to meet all DAP deadlines. Once the data quality analysis is received, participants will collaboratively review gaps identified by Contexture and develop resolution plan to address those high risk and moderate risk parameters. Contexture's responsibility is to run that data quality analysis, share it with the participants, and discuss any gaps and support the participants in developing their resolution plan.
We want to ensure that you have all our contact information accessible. So please reach out to your QI advisor with any questions. Our emails are all listed here on this slide. If you are not sure who your quality improvement advisor is, please email dap@contexture.org. If you are a net new participant or you're not an HIE participant yet, please contact getconnected@contexture.org. And then to learn more, you can visit our website, which is listed here in the slide, and the guys can repost that in the chat if needed.
All right, so we don't have a lot of time, but hopefully we can cover your questions. I'll pass this to Kyle and Tyler just to see if we were able to answer some questions via chat or we need to read that out loud. So Tyler and Kyle.
This is Jeremy. Real quick question. What is the preferred method of billing for the increased DAP amount that's approved? Once approved, you bill directly to the insurance company, the increased amount?
So all billing questions related to the DAP. And so as you know, DAP is managed by Access, not by Contexture. So we don't have access to anything related to billing or claims. So we'll probably direct you to reach out directly to the Access team about that.
Okay.
And I know a lot of people in the chat up a few times about, and I know Cassie just covered this about DAP advisor. I would and we can put it in here. If you don't know who your advisor is currently, whether that's your quality improvement advisor or your SDOH advisor, please email dap@contexture.org to find out who that is. We can point you in the right direction of who your quality improvement advisor is or who your SDOH advisor is. And also, it looks like there's been some questions just here at the end regarding the timeline for the participant list, which is obviously going to kick things off. If you do need more time, please work with your quality improvement advisor on that time and getting that in, because that's who you should be returning that to. So if you do need extra time, please email them and just work with them on that. We have some other questions here as well.
Tyler, I think you're breaking up just a little bit.
Can you hear me now? Yeah.
You sound like really far away. I think somebody has their hand raised. Walt. Angie, did you have a question while Tyler's figuring his stuff out?
The quality data that's a new milestone this upcoming year for hospitals. Is there going to be another call to go into some specifics on what's going to be required on this quality data? I get bits and pieces. You're going to have to do test files, but really, if files have to start getting formatted or there's going to be different requirements to come through, when is that information going to be provided? I mean, this call was great. You went through and read all the timelines, but there's a lot of specifics missing.
Yeah,
so
thank you for
calls.
Yeah, thank you for pointing that out. So this is just an overview, and we want to make sure that you have a communication directly to your QI advisor just to go over specifics as far as programs. So these questions can be covered. So if we need to set up a meeting just with your teams, we're happy to provide that meeting just to go over that.
Again, if there's documentation out there that's published, we can read it. I'm just kind of curious, as like I said, on the quality, what that's going to entail going forward. I'm fortunate enough, same thing with the PACS. There was no information provided on that whatsoever. I'm fortunate enough, I have a call tomorrow with our team, but the new SAL just says, we agree that we're going to provide the PACS information. Again, what does that entail? A portal, setting up data like that for electronic visuals, copies of images of x-rays and CAT scans. That's not anything that any IT department can put together, in a day or two. And then just my second comment to the gentleman that asked about the billing and the increase in the DAP or billing your expected DAP. I've checked with our access providers, and they don't care. None of them want to see any DAP payment on there. When hospitals submit claims, they submit total charges, and the payer systems are loaded with whatever your percentage is of your DAP, and that's how it processes. So that either question, I forget if it's on the milestone or was an announcement, is very misleading. And if access is on the line, the access payers don't want it. They get full bill charges. Their systems are loaded with the 2.5%, 3%, depending on, who you are, and they know how to process it. So that again needs some clarification, whether it be from access or Contexture, if you guys are speaking to access, because it's very misleading. You don't take a UB and then, subtract out what your contractual amount is and then add in 3%. That was just my comment. Thank you.
Thank you. We can pass
Thank you.
that comment along.
I know we're at time here, and we have a few other questions that some were answered in the chat, and I want to make sure that we're able to follow up on all of them. So we can follow up. The presentation, the slides will be sent out. I know there was a lot of questions about that. So we'd like to send the slides out as well as a follow-up to answer all these questions that you all had sent in. We can re-answer some of them and some of the ones that need a little bit more detail. Not too much more time.
Tyler and Kyle, do we have any other questions that we need to address?
We do have a few. Do we have time to go over them, Israel?
I think we can. If people have time to stay for questions, we appreciate that. Again, and we're recording this webinar. And if you have to drop, you'll get access to the recording, and also we're gonna post it in our social media and YouTube, I believe.
Okay. Thanks, Israel. We did get a couple of questions on the transition to the new platform. I have a question here. Can Contexture provide an update on the transition to the new platform? Specifically, when is the cutover date? I know we had Jamie on the call before. Jamie, are you still on to answer that question?
Hi, yes, I'm still on. So while we don't have an official cutover date, we are currently working on getting all of the data centers actively moved over to the new platform. And that is a process that cannot be done all at one time. So we do have to do that in several iterations of getting those data centers over. And that is in large part why the workbook and getting that data integration is included in the DAP program this year. So certainly as we have more information, we will share that, but there is not a hard and fast cutover date. But I will say that it will be in 2025.
Thanks, Jamie. We do have another question about the one platform. If we've been sending ADT profiles via secure file upload, does this go away with the one platform? Tyler, looks like we have you down for that question.
Yeah. So for that specific question, is because it requires a little bit more detail, I would say reach out to your QI advisor, because what we're going to need to do is probably bring in our project management team, who's more in the weeds on what that transition looks like and what's going to be available on the new platform, as well as what might not be available on the new platform. So I'd say reach out to your QI advisor. We can hook you up with the project management team and get a little bit more details if you are a participant that happens to be sending data through.
Thanks, Tyler. Another question here. Do the integrated EHRs know that you are switching to the one platform so that our currently electronically submitted data continues to flow? I can take this. We are asking participants to fill out the One Platform workbooks along with your vendors. So your vendor will be aware that we are switching, and we get all that information from your vendor to make the integration as seamless as possible. So yes, the vendors will be aware. What else do we have here? Regarding the PACS milestone, Jamie, if you're still on, could you speak to what exactly PACS is and what the participant requirements are within the scope of work for PACS?
Right. So there are, as mentioned, there are still several things that are being left to be determined in terms of exactly how that will be implemented. But essentially what this is, it is a link back to the organization's PACS system, allowing us to access that imaging within their system versus storing images on the HIE itself. So essentially the SOW is to gauge interest in that and being able to move that functionality into our One platform.
Thank you, Jamie. I do see a hand up, Christine. If you want to go ahead and unmute and go ahead and ask your question.
Excuse me, I actually seem to have been answered in the chat that's been going along with this.
Okay, perfect. Just reviewing our questions here. How much is the fee to use HIE in 2025? Jamie, could you speak to that?
Yeah, so that is currently in the works as well. So we have our executive leadership team finalizing that structure, and it will need to have board approval before we can release it to our participants. We expect to be able to provide that information likely in Q3 of 24 to prepare us for those 2025 fees.
Okay, thank you. I think that's all I see. Tyler, do you see any more that I missed that weren't answered in the chat?
I think that was all the questions that were either answered. I know we covered a few here. I know somebody had asked about the definition of provider types. Obviously, we use a lot of acronyms and numbers and things like that. I did provide a link here recently in the chat to access the website. It's a PDF download from their site that just lists out all of the access provider types. So the full list, so you can see which ones are pertain to you, and then obviously go to notice to see if they are eligible provider types for the DAP program.
And again, if you have more questions, feel free to reach out to your QI advisors, set up a meeting, a time to go over your specific questions, and we're happy to set that up for you.
And again, if you don't know who your QI advisor is, again, or your SDOH advisor, email dap@contexture.org, and I will drop that in the chat here as well.
And Ariel, from the SDOH team, are you on the call still? I think that there's a webinar coming up for the SDOH team. I don't know, you wanted to quickly talk about it.
Hi, yeah, Tyler, hi. Sorry, I did end up staying on a little bit. So for those organizations who are in SDOH DAP 2024, we are going to be sending out a flyer to register for our webinar that we're hosting on February 28th. More information about that coming to you all, but here is where we'll review how to manage the milestones for 2024, how to utilize the platform and adapt it to your workflow to ensure you're able to meet your milestones through referrals and managed cases. So more information on how to register coming soon.
Thank you, Ariel. And if no more questions, we can conclude and close this presentation. Again, if you have any specific questions, reach out to your QI advisor. If you don't know who that is, reach out to dap@contexture.org. We thank you, and we apologize we went over. So a lot to cover and great questions. So thank you again, and hope that you guys have a great day. And don't forget to reach out.